Good day, everyone. In this video, we are going to continue the discussion on the liver syndromes. In the basic theory, we have mentioned that the wind can be the internal wind, and there are many causes of the internal wind, which can be the blood deficiency, the yin deficiency, the excess heat, excess fire, and so on. So different causes can result in wind syndrome, and these wind syndrome mostly they are related to the liver. The reason is because the wind, the manifestation of the wind is something moving, such as the tremor. The tremor, something moves, is related to the wind, and the wind is related to the liver. It's also from the 5 elements. That's why all these moving manifestations we're going to study in the liver syndromes. The internal stirring of liver wind. How many causes? It can be the liver yang, it can be the liver heat, it can be liver yin deficiency, it also can be the liver blood deficiency. So these manifestations, different syndromes, are actually developed from the previous syndrome, such as the liver heat, the liver fire, the upflaming liver yang, hyperactive liver yang, the upflaming liver fire. So we're going to focus on the previous syndrome and manifestations. We're going to add some other symptoms. The liver yang transforming into wind. So this is a worse condition due to the hyperactive liver yang. The patient will have the manifestation of the hyperactive liver yang, and then the wind symptoms mostly happens vertigo or dizziness. Why the vertigo? We think about the wind. The vertigo, the patient feels the dizziness, and this dizziness, they can feel something spinning. So when you ask the patient will tell you that they feel the world is spinning. So that's something moving. Something moving, you think about the wind. Tremors of the limbs, fingers, the numbness of the hands and feet. So the other manifestations can be also also due to the movements, deviation of the. But from these are not only due to the liver yang. Tongue is red with greasy coating. The key manifestation: vertigo, tremor, numbness of the limbs, distending headache. When we diagnose the patient with liver yang transforming into wind, the patient will have the manifestation of liver yang. That's how to distinguish liver yang with the other syndromes. And then liver yang transforming into wind, the patient will have the other symptoms, that's the wind symptoms. So hyperactive liver yang plus the wind, vertigo, tremor, numbness, distending, that's from the qi. Extreme heat generating the wind. Where does the extreme heat come from? That's from the liver fire. So in the previous video, we have introduced the upflaming liver fire. The upflaming liver fire, the patient may present with fever. Eye. So this is the eye fixed outwards. This is actually a more severe condition. Restlessness, unconsciousness, so even worse, already affects the heart. Thirsty, these are all the heat. High-grade fever, wind-stirring symptoms. What's the wind-stirring symptoms? Something moving. The moving can be the limbs. So this is not only the trembling. It can be the spasm. And because of the heat, the patient may present with the high-grade fever. The patient also will manifest with red tongue and dry yellow coating. Why it is dry? That's because of the heat. The heat will consume the water. Yellow is the color of the heat. So that's how to distinguish with the hyperactive yang and extreme heat. All results in the wind. Due to indeficiency, so this syndrome also develops from the liver indeficiency. It will mostly manifest as internal liver wind and malnourishment of the tendon. That's because of the ligament are related to the liver. Twisting, tremors, tidal fever again. That's the indeficiency. From the indeficiency plus something moving. The patient also may present with vertigo. So although we didn't mention here, if you write the vertigo, dizziness, that's still correct because the indeficiency in the liver, especially from the results in the wind, the patient will feel dizziness, will feel vertigo, something is moving. So the patient will present with deficiency heat or indeficiency symptoms. These two terms are exactly the same. Blood deficiency generating wind. This symptom develops from the liver blood deficiency. The liver blood deficiency, the patient may present with dizziness, numbness of the limbs because of the malnourishment of the limbs, spasm of the hands and feet, muscle twitching, that's something moving, but the patient must present with pale tongue, white coating. As you can see, this is 4 internal wind. This is the only one with pale tongue. The reason is the other 3 symptoms are all heat, although it can be excess heat or deficiency heat, but they all related to heat. So the blood deficiency generating the wind is the only one with a pale tongue. The pale tongue is from the blood deficiency. So the patient will have the symptoms of blood deficiency plus something moving. So that's how to remember these different manifestations. Until now, we have introduced the heart, the lung, the liver, the spleen. We're going to introduce the kidney in the next video. As you can see, there are many symptoms. There are even more symptoms. How do you remember them? Or how do you recognize them when you see in clinics or when you see in your exams, that you need to remember them in groups, such as the blood deficiency symptoms. What's what can what can be in the blood deficiency symptoms, such as dizziness, blurred vision, visual deterioration, night blindness, and these are more related to the liver. Insomnia can be the heart blood deficiency. So that's why from the differentiation, we also introduce from the 8 principles. From the disease nature, we introduce the qi, blood, body fluid, different symptoms from there. You're going to remember those, and then you're going to structure these different symptoms. Cold retention in the liver meridian is the last symptom in the liver disorder. This syndrome manifests as the cold attacking the liver, especially the liver meridian. When we focus on the liver meridian, we will know that this syndrome mostly related to the the symptoms mostly related to the meridian. So we will see the pains in the lower abdomen, especially on the side, on both sides, the disorder in the external genital area. The patient also may feel the headache on top of the head, on top of the head. Why on top of the head? So from the basic theory, you already studied that the liver meridian travels to the top of the head. The patient will present with cold symptoms. What are cold symptoms? The manifestation can be relieved by warmth. The patient, the tongue is pale, white coating, that's due to cold. The patient also will have cold limbs, that's also due to cold. So the patient will have the manifestations of the liver problem and then the problem with the cold condition. The causes of this manifestation mostly is from external coldness, so from the exogenous coldness. These are the common symptoms that we are going to introduce in the liver disorder. Because the liver and the gallbladder are the coupled organs, so we're going to introduce the gallbladder afterwards. The gallbladder disorder is not complicated. As you can see, there are only a few 2 or 3 symptoms. Firstly, the gallbladder stays with the liver. The meridian also connects to the liver, storing and excreting the bile, dominate decisions, making and regulating emotions. So the emotion problem, we're going to think about the liver, the qi regulation. We also need to think about the gallbladder, the dominating decisions. This is very special in Chinese medicine theory. The decision making is from gallbladder. So the example that we have mentioned previously in the basic theory when we studied the gallbladder, we have the example that there's one one lady that she studies in the university and she's actually got very good marks. And then these two boys love the girls. Then the girls have difficulty in choosing which one to be the boyfriend. And afterwards, after the lady graduated, because she's quite excellent, she got different offers from different companies. And then she also have the difficulties in choosing which company, which offer to accept. The reason is because she could not make a decision. That's something we can see from our daily life. Some people, they are quite difficult to make decisions. They feel this is good, but something wrong there. The other one also good, but also not perfect. So they will have problems in making decisions. How can we help, or how can we ask them to help? We're going to focus on the gallbladder. We're going to recover the gallbladder function, decision making. Symptoms of the gallbladder. First one is the damp heat in the liver and gallbladder. Because the liver and gallbladder are the coupled organs, and they also stay together. So sometimes it is very hard to distinguish from the liver and gallbladder because most of the symptoms, they happen together. So the syndrome causes damp heat in the liver and gallbladder. The damp heat, dampness, the heat. This syndrome, mostly the patient will have damp heat syndrome and mostly happens from the meridian. Especially the excessive sweating in the genital area. Swelling or pain in the external genitalia. Thick, yellow, smelly, foul-smelling urine. Alternating fever and chills. So these are the liver and gallbladder. The reason why we need to focus on here, that's because of the liver meridian and gallbladder meridian travels around this area. That's why this is also an example of the meridian differentiation. So we said previously, the meridian differentiation we're not going to talk a lot because we're going to study in the second year from the acupuncture and meridian and the motivation. How to use the meridian differentiation. That's from where the meridian travels, such as the genital area. That's where the meridian travels. So we're going to focus on if the patient presents with this area problem, we're going to focus on the liver and gallbladder. So the damp heat can present here. Again, the infertilities also can present here because the heat, the dampness also will reduce the rates of conceiving. So if a patient presents with infertilities with damp heat in the liver and gallbladder, the patient may have red tongue, yellow greasy coating. The leukorrhea may be problem. So that's the typical manifestations of this syndrome. Gallbladder cheese stagnation coupled with phlegm. In this condition, it's a qi stagnation, and then the patient will have phlegm. The most typical symptom is fear. The patient will feel fear. The fear is the emotion of the gallbladder. Nervous, palpitations, insomnia, restlessness. You see, all these symptoms are more related to the emotion. The patient will feel distension, tightness in the chest and ribs area, dizziness, blurred vision, bitter taste, nausea, vomiting. That's from the liver affecting the spleen and stomach. Qi stagnation. Where can you see the qi stagnation from these some manifestations? Distending, tightness. The patient also may present as frequent sighing, wiry pulse. So that's the key manifestations. These are different symptoms in the liver and gallbladders. In the next video, we're going to talk about the kidney symptoms. Thank you for your attention.